The path to Medicare awareness starts with getting the facts you need to understand your options so you can make informed decisions. And we know sometimes that can be confusing. You can spend hours, even days, researching the subject. Or you can take a deep breath, relax, and let us show you the way. We're here to help. Different parts of Medicare. Medicare is the federal government's health insurance program. It's available to people age 65 and older, those under 65 with certain disabilities, and those with end-stage renal disease. The key to understanding Medicare is understanding the 4 parts that make it up: Parts A, B, C, and D. Parts A and B make up what's known as Original Medicare. They work together to provide hospital and medical insurance. Part A pays for inpatient hospital services, along with skilled nursing facility stays, home health care, hospice care, and transplants. Part B pays for doctor visits and other outpatient services, such as speech and occupational therapy, ambulance transport, home health care services, medical and lab tests, durable medical equipment and supplies, preventative care, mammograms, and Pap tests. That brings us to Medicare Part C, also known as Medicare Advantage, which isn't exactly a part of Medicare. It's an alternative to Medicare Parts A and B. Let me explain. When it comes to your hospital and medical insurance, you have a choice. You can get Parts A and B directly from Medicare, or from a private insurance plan approved by Medicare. If you go with a private plan, like Blue Shield of California, you're covered for Medicare with Part C. Part C covers everything Medicare Parts A and B does, and it often has added benefits, like prescription drug coverage, dental coverage, vision care, and other additional benefits. That brings us to the last part of Medicare, Medicare Part D, prescription drug coverage. You can get this as a standalone plan, or included with Part C. That could be with an HMO, PPO, or other Medicare plan that includes prescription drug coverage. These 4 parts are the core of your Medicare insurance. That's hospital, medical, and prescription drug coverage, plus the private insurance company option. It's how you put those parts together that determines the benefits you have. Now that you know how Medicare works, you're ready to continue your journey toward enlightenment by taking a closer look at Original Medicare, Parts A and B. Original Medicare Parts A and B. What's not covered? Original Medicare is often a great option for beneficiaries. However, it doesn't cover the cost of everything. There are some costs you have to pay for out of your own pocket. With Medicare Part A, there's usually no monthly premium, but there is a deductible, as well as daily copays for hospital stays of 60 days or more. A deductible is the amount you must pay before Original Medicare begins to pay. A copay or copayment is a fixed dollar amount that's your share of the cost of a medical service or supply. With Medicare Part B, you pay a monthly premium, a deductible, and co-insurance. Co-insurance is the percentage of costs you're required to pay for services. Here, it's typically 20% of the Medicare-approved amounts for doctor services, outpatient therapy, and durable medical equipment. With Medicare, you share the cost of some services, and the cost of others isn't covered at all. That includes the cost of prescription eyewear and contact lenses, dental care and procedures, hearing aids, nursing home care after 100 days, routine foot care, and cosmetic surgery. You have to pay for these services and other costs not covered by Medicare yourself or with another insurance plan. If you need help, financial assistance is available. That includes help with out-of-pocket costs for those on Medi-Cal. Health plans like Blue Shield of California can provide you with details. But before you can take advantage of any Medicare services, you must first enroll for benefits. Let's pause and take a deep breath here. Inhale and exhale. Then we'll show you how that's done. When can I enroll in Medicare? Learning when to enroll is one of the most important steps on your Medicare journey. Medicare enrollment is not automatic for most people. You have to sign up, unless you already collect benefits from Social Security or the Railroad Retirement Board. You can only sign up for Medicare at certain times. If you miss the deadlines, the start of your coverage may be delayed, and you may pay higher premiums as a result. So when should you enroll in Medicare Parts A and B? That depends on whether or not you're still working at age 65. If you're retired or planning to retire, sign up during the initial enrollment period. That's the 7-month period that includes the 3 months before your 65th birthday, the month you turn 65, and the 3 months after. For example, if your birthday is in June, you can enroll as early as March and as late as September. But what if you're still working at age 65? Even if you have health insurance through your employer, it's probably a good idea to still sign up for Part A during your initial enrollment period, because it's usually free. Whether or not you sign up for Part B depends on the size of your company, if they provide health insurance, or if you receive coverage through the Affordable Care Act. If your company has 20 or more employees and you're happy with your coverage, there's no need to enroll in Medicare. Your employer's plan can be your primary coverage, and you can sign up for Part B during a special 8-month enrollment period that begins the day you stop working. If your company has less than 20 employees, or you're insured through the Affordable Care Act, it's best to enroll in Part B and make Medicare your primary insurer. Before we move on, there's one more scenario we should discuss. That is, Medicare and Medi-Cal. Should you enroll in Medicare if you're already insured through California's Medicaid program, also known as Medi-Cal? The answer is most likely yes. Those who qualify for both Medi-Cal and Medicare are dual eligible. That means they're eligible to be covered by both programs. No matter what your situation, it's important to sign up for Medicare as soon as you're eligible. If you miss your initial enrollment period, you'll have to wait until the next open enrollment period. It could be months before your benefits begin, and you may be charged a penalty. You can sign up for Medicare at your local Social Security office or at socialsecurity.gov. If you have any questions in the meantime, call Blue Shield of California or an authorized Blue Shield broker. You can count on us for help. Your Medicare coverage choices at a glance. We've covered a lot already, so let's slow down a bit as we focus on finding the coverage that's right for you. You have 2 main choices. You can choose Original Medicare, Parts A and B, with or without a Medicare supplement. Or you can choose a Medicare Advantage plan. That's Part C. Original Medicare is managed by the federal government and offers hospital and medical insurance. It lets you use any doctor or hospital in the country that accepts Medicare. But it doesn't cap your out-of-pocket costs for expensive medical procedures, like surgery. It also doesn't cover the cost of prescription drugs. You need to enroll in a separate Medicare Part D plan for that. Medicare Advantage plans are plans approved by the government and run by private insurance companies or health plans like Blue Shield of California. These plans cover the same benefits as Original Medicare, but may include prescription drug coverage and other extras like dental, vision, and hearing benefits. They offer managed care within a network of providers. If you go to an out-of-network doctor or hospital, you may not be covered, or you may have to pay more. There are special Medicare Advantage plans for those who qualify for both Medicare and Medi-Cal. These dual-eligible special needs plans coordinate Medicare and Medi-Cal coverage and offer additional benefits too. Both Original Medicare and Medicare Advantage plans require you to pay the Part B premium, and you may pay a separate monthly premium for a Medicare Advantage plan. If you choose Medicare Parts A and B, you can enroll in a Medicare Supplement or Medigap plan to get help paying some of your out-of-pocket expenses. Some Medicare Supplement plans include vision coverage, an allowance for over-the-counter items, gym memberships, and more. Before we go any further, let's take a closer look at Medicare Advantage plans. Medicare Advantage plans, Part C. Medicare Part C, also known as Medicare Advantage, is an all-in-one alternative to original Medicare. These bundled options are offered by private insurance companies or health plans like Blue Shield of California. They include the full benefits of Medicare Parts A and B in a single plan. That's hospital and medical coverage in one. Many also include prescription drug coverage, so you won't need to buy a standalone Part D plan. And many come with valuable extras, like benefits for over-the-counter items, hearing, dental and vision care, and even gym memberships. With a Medicare Advantage plan, care is provided through a local network of doctors and hospitals, and you get the convenience of having just one insurance company for all your claims. These plans can also help lower your costs. In addition to extra benefits, there are limits on out-of-pocket expenses, and some plans even cost less than original Medicare. All Medicare Advantage plans include coverage for Parts A and B. Additional benefits, costs, and insurance networks vary. You can enroll in a Medicare Advantage plan during your initial enrollment period, when you first become eligible for Medicare. After that, most people will have a chance to add, drop, or change a Medicare Advantage plan during Medicare's annual election period. That's October 15th to December 7th of each year. Some people qualify for special enrollment periods. Depending on the qualifying event, the special enrollment period timeframe will vary. Those who qualify for both Medicare and Medi-Cal can join, switch, or drop a Medicare plan one time in each of the following special enrollment periods. That's a look at Medicare Advantage plans. Now let's continue our journey with a look at Medicare Supplement plans. Medicare Supplement plans. Original Medicare pays a good portion of your healthcare costs, but it doesn't cover the cost of everything. Medicare Supplement, or Medigap plans, help fill in the gaps by covering costs that original Medicare doesn't, like deductibles, co-pays, and co-insurance. So you can breathe a little easier knowing there's a limit to your out-of-pocket expenses. These plans are sold by private insurance companies or health plans like Blue Shield of California. While core benefits are standardized, some plans include extras, like an allowance for over-the-counter items, vision and hearing benefits, and even gym memberships. There are Medigap options designed to meet a range of coverage needs and budgets. Each is categorized by a different letter of the alphabet. Standardized plans with the same letter offer the same benefits, no matter who sells them. While benefits are identical, costs can vary widely from company to company. So it's important to find a plan that offers the benefits you want and to compare prices. With a Medicare Supplement plan, you pay a monthly premium in addition to your Part B premium. Since these plans don't cover prescription drugs, you have to purchase that separately. And depending on the plan you choose, you may not be covered for routine vision and dental care or hearing aids. To get a Medigap plan, you have to be enrolled in Medicare Parts A and B, but you can't have Part C, a Medicare Advantage plan. The best time to buy this coverage is when your acceptance is guaranteed. That means you can't be denied coverage or charged more because of your medical history. Your acceptance is guaranteed in many situations. Here are a few of them. During your initial Medicare enrollment period, when you're 65 or older and leaving an employer's plan, within 12 months of leaving a Medicare Advantage plan you joined when you enrolled in Medicare, if you move to a different state and lose your employer's coverage or Medicare Advantage plan. Before we take the next step in our journey, take a deep breath and relax. While you catch your breath, let's compare key features of the plans we just discussed, Medicare Advantage and Medicare Supplement plans. Both help with your out-of-pocket costs, but in different ways. A Medigap plan works hand in hand with original Medicare, Parts A and B. With a Medicare Advantage plan, Your hospital and medical benefits are provided by a private health plan approved by Medicare. Medigap plans don't cover prescription drugs, and many don't include vision, dental, or hearing benefits. A Medicare Advantage plan can include all that in a single plan. With a Medicare Supplement plan, you can visit any medical doctor or hospital that accepts Medicare anywhere in the U.S. With a Medicare Advantage plan, your doctors and hospitals are part of a specific network. With the Medicare Supplement plan, you must pay a monthly premium along with your Medicare Part B premium. Some Medicare Advantage plans have $0 monthly premiums. When it comes to Medicare, there's a lot to consider. It's important to explore your options and to find the Medicare plan that offers it. You can count on us to help. Our final stop on your Medicare journey is a critical one. That is, understanding your prescription drug coverage. So take another deep breath, exhale, and we'll continue. Prescription drug plans. Medicare Part D helps pay for generic and brand-name drugs not covered by original Medicare. These plans are provided by private insurance companies or health plans like Blue Shield of California. While the benefits they offer are standardized by Medicare, there are differences. Plans have different premiums and copays, and they cover different drugs. That's an important distinction. Before you sign up for any plan, check that your medications are included in the plan's formulary. That is, its list of covered medications. This list varies by plan, and it can change annually. Check each year to see which drugs are covered, what they cost, and where prescriptions can be filled. There are two ways to get your prescription drug coverage. You can enroll in a standalone Medicare Part D plan if you're insured with Original Medicare, or you can get coverage as part of a Medicare Advantage plan. No matter how you get this coverage, most prescription drug plans work the same way, in 4 stages. Stage 1 is the yearly deductible stage. You pay 100% of your costs until you reach your drug plan deductible and your benefits begin. Next is the initial coverage stage. Here, your plan pays benefits until you reach an initial coverage limit. You may have copays or coinsurance. Then you enter the coverage gap stage, where you pay 25% of your costs until you reach yet another plan limit. That puts you in the catastrophic coverage stage. While here, you pay just a small percentage of your costs for the rest of the year. You can first sign up for Medicare Part D during your initial enrollment period. If you miss the deadline, a premium penalty may be added to your monthly premium. If your income is limited, you may qualify for extra help with your Medicare prescription drug plan costs. Final thoughts and considerations. You've reached the end of your journey to Medicare Enlightenment. Now that you understand how Medicare works, you can relax, knowing you have the tools you need to make informed decisions. If you have any questions or need answers, assistance is available. You can turn to important resources like these. And you can always count on us for assistance. We're here to help you every step of the way. Call Blue Shield of California or an authorized Blue Shield broker. Attend a free Medicare information session or visit us online.